Hyperkalemia is a medical condition characterized by elevated levels of potassium in the blood. It is a common electrolyte abnormality that can have profound effects on various organ systems, particularly the cardiovascular system. In this script, we will delve into the different aspects of hyperkalemia, including its causes, clinical presentations, and management strategies. Renal tubular acidosis, RTA, is a group of disorders characterized by impaired acid-base regulation in the kidneys. RTA type 4, also known as hyperkalemic distal RTA, is associated with hyperkalemia. This condition occurs due to reduced excretion of potassium by the distal nephron. We will discuss the pathophysiology, clinical features, and diagnostic approach to hyperkalemia and RTA. The treatment of hyperkalemia involves several pharmacological agents that aim to lower the serum potassium levels. These include potassium-binding resins such as sodium polystyrene sulfonate, loop diuretics, and insulin with dextrose. We will explore the mechanisms of action, dosing guidelines, and potential side effects of these medications. Chronic kidney disease, CKD, is a leading cause of hyperkalemia. The impaired renal function in CKD leads to reduced potassium excretion, making these patients more susceptible to developing hyperkalemia. We will discuss the pathophysiology, risk factors, and management strategies specific to hyperkalemia and CKD. Acute kidney injury, AKI, can lead to rapid and severe hyperkalemia. The underlying mechanisms involve decreased renal function and impaired potassium excretion. We will explore the different causes of AKI-associated hyperkalemia, its clinical implications, and the management approach in this setting. Dialysis is an essential treatment modality for patients with end-stage renal disease. However, dialysis-induced hyperkalemia can occur as a result of interdialytic potassium accumulation or intradialytic shifts. We will discuss the mechanisms, prevention strategies, and treatment options for dialysis-induced hyperkalemia. Hyperkalemia has significant effects on cardiac electrophysiology and can lead to life-threatening arrhythmias, including ventricular tachycardia and fibrillation. We will examine the pathophysiology of these arrhythmias, the ECG manifestations of hyperkalemia, and the management principles in preventing and treating arrhythmias associated with hyperkalemia. Certain endocrine disorders, such as adrenal insufficiency and hyporeninemic hypoaldosteronism, can contribute to the development of hyperkalemia. We will explore the underlying mechanisms, clinical features, and management strategies specific to hyperkalemia and these endocrine conditions. Critically ill patients, particularly those admitted to the intensive care unit, are at increased risk of developing hyperkalemia due to various factors such as acidosis, tissue breakdown, and medication use. We will discuss the unique challenges in managing hyperkalemia in critically ill patients and the appropriate treatment approaches. Several medications can contribute to the development of hyperkalemia through various mechanisms, including inhibition of potassium excretion or increased potassium intake. We will highlight the commonly implicated drugs, their mechanisms of action, and strategies to minimize the risk of hyperkalemia in patients receiving these medications. Rhabdomyolysis, a condition characterized by skeletal muscle breakdown, can result in hyperkalemia as a consequence of potassium release from damaged muscle cells. We will discuss the pathophysiology, clinical implications, and management strategies specific to hyperkalemia and rhabdomyolysis. Hyperkalemia can occur in pediatric patients and presents unique diagnostic and management challenges. We will explore the different etiologies of hyperkalemia in this population, age-specific considerations, and appropriate treatment strategies. Severe hyperkalemia is a medical emergency that requires prompt intervention to prevent life-threatening complications. We will discuss the stepwise approach to managing severe hyperkalemia, including stabilization measures, acutely lowering potassium levels, and preventing recurrence. Hyperkalemia is a complex condition that can arise from various underlying causes and has significant implications for patient outcomes. Understanding the pathophysiology, clinical presentations, and management strategies is crucial for healthcare providers to effectively diagnose and treat hyperkalemia. By addressing the different aspects of hyperkalemia in this script, we aim to provide a comprehensive overview of this important medical condition.